80. Who's in seat 80? Representative Gonzales, you recognize.
Thank you, Mr. Chair. So the false positive rate concerns me. Are we counting those as positives? Is that one reason that Arkansas is showing so many more positive cases, because we're getting those false positives out of these antigen tests?
No, they would not automatically be counted as a positive case. But it's possible that it could be. But the antigen tests are not the bulk of the tests that we're doing in Arkansas. Most of our testing is still PCR.
So are the antigen tests the tests that we're using for our athletes to test them daily to decide whether they can or cannot play?
So my understanding, for example, the Southeastern Conference does 2 PCR tests twice a week, and then they get an antigen test the night before they play. And the reason for that is you can get a quick turnaround in the result.
Yeah, I understand that, but the problem with that is what you just stated, a high rate of false positives.
Well, and then they would have to follow up with the PCR test, and they would have to make some kind of a decision. But that's part of their strategy, and they're aware of that.
Yeah, okay. I just see that as being hugely problematic if that's what we're using to say, yes, you have COVID-19, or no, you don't, and then if that's the only test that they're getting, and that gets turned into the health department, and we cause contact tracing and other contacts of them to stay home for 2 weeks, that's hugely problematic for the state.
For a screening test with a positive, then I think it would be prudent to go ahead and do a PCR test.
Yeah, I agree with that, but I don't know that that's actually what's going on out there. So
I think you are correct about that.